my name is Claire Green and I'm a registered general nurse, and I work in general practice in England, and I work mainly with respiratory patients. I trained with Karina Grant about 5 years ago, I think it was, Karina, and I did level 1 with you, Quantum Touch, and I did level 2. And that changed my life because it made me realise how connected we all really, really were. So when I came back to work, I would often deal with patients who were coming in, their blood pressures were raised, they were stressed, they were agitated, and I would show them the heart breath, and I would get them to run the breath through their heart, breathing in and out very gently. And I found not only did it relax them, but on average, it brought the blood pressure down by about 20 millimoles. And I thought, wow, this is really powerful. Whenever I used it, I just said, can I just show you this exercise to relax you? It's a really powerful exercise. It's the most powerful, simplest exercise I know of. Never ever touched anybody. Always ask them consent. Is it okay if I show you? And I would run the heart breath with them. And I found not only did it bring the blood pressure down, but being a respiratory nurse, patients were holding so much tension within their chest and their heart area that when they came into me for blowing tests, sometimes there was so much tension there, they couldn't always blow out. So I would sometimes stop and say, oh, do you mind if we just do this exercise? I found it's really good at relaxing you. And then I found that they would be relaxed and would be able to really give blows after that. So I was using it like that for a while. I did show my doctors at a meeting one day. I said, I use this relaxation exercise sometimes before blood pressures, and it's also very good for you staff, if ever you're feeling stressed or anxious, to use this breath. And I showed them what I used. I've used it, I cannot tell you how many times the past 18 months with COVID over the telephone, because people would be so distressed, they'd be crying on the phone to me. And, I would do my consultation and I would say, do you mind if I just show you at the end this really powerful breath to relax you, to help you? And they would say yes. So I would say, do you want to go hands-free? Do you want to have one hand on the phone? And I would talk them through just 2 minutes, put your right hand over your heart, your left hand just below your tummy button, and a really gentle breath in for 4 or 5 and run the breath out for 4 or 5. And I would just very gently breathe with them over the phone. And I would run it a few times and I would run the breath with them. And the person would normally go, oh my gosh, that was amazing. I haven't felt like that before, or I haven't felt like that in ages. That is the normal reaction I get. Just remember, bring the breath in through the heart and out through the heart. That's the magic of this exercise. And I would often say to people, do it before you go to sleep at night. Use it as a medicine. Do it maybe when you wake up, maybe after lunch and in the evening. So I've used the heart breath, I cannot tell you how many times. I have used quantum touch in other ways with my colleagues. I never touch anybody. I always ask them for consent. And if they're distressed, something's happened. I had one colleague come in to my door and I said, are you all right? She said, oh, didn't you hear I was in a car accident this morning? I said, oh, no. Yes, she said, so I've taken the morning off, and it was my lunchtime. I said, do you mind if I do something to try and help you? She said, oh, no, that's fine. I said, well, I'll just wash my hands and pop to the toilet. And I came back and I did some work with her. And she said, oh my goodness, she said, that has made me feel amazing. She said, I felt I was split down the middle. She said, now I feel as though I've come back together. Those were her exact words. Quantum touch, the breathing I can use in so many ways. But I'm so grateful that I've had these skills and that I've been able to use them. And particularly with all the distress for me with COVID, the anxiety coming off some of the calls. I've come off the calls, I've put the phone down and I've just run the breath And I thought, right, and I've sent my breath out to that patient. That's complete. I cannot do any more. And I'm able to let go completely and just trust that I've done my best. So I now use it. I do some energy exercises, 15 minutes in the morning on a Monday morning before one of our meetings. And I do a mixture of exercises. I use a little bit of, I always finish with quantum touch. I always finish with the heart breathing. Some people say to me, oh, where did you get that from? And I say, I did a quantum touch course. Anyone can do it. Karina Grant's an amazing teacher, and you can have a look. And yes, so I'll often say that. If I've done any work with my colleagues who've not been well, because I wouldn't do other work with patients, but if I've ever done any work with my colleagues who've been distressed or not well, and they've, the reaction is, oh, you've got the touch. And I say, we all have the touch. We all have the touch. After a morning doing quantum touch course, I said, you will be amazed what you can do. I said, you'll be able to move so much and do so much. We all have it. So that's, I never make any claims that I'm anything that they can never be, because we can all be. I think that's what COVID is now, for us all to be the best that we can be in whichever way we can be, and to be free with, within our guidelines, to work within our restrictions, to work with respect for everybody and reverence for everybody, but to share our gifts in whichever way we can. So that's me.